How does the autoimmune response in rheumatoid arthritis differ from others? Have you ever wondered how the autoimmune response in rheumatoid arthritis is unique compared to other autoimmune diseases? Rheumatoid arthritis, or RA, is an autoimmune condition where the immune system mistakenly attacks the synovial lining of joints. This leads to chronic inflammation, joint damage, and deformity. While it shares some features with other autoimmune diseases, RA has distinct characteristics that set it apart. One major difference lies in the target tissue. In RA, the immune system primarily targets the synovium, which is the lining of the joints. This causes inflammation and destruction of cartilage and bone. In contrast, other autoimmune diseases like type 1 diabetes focus on different tissues, such as the insulin-producing beta cells in the pancreas. In RA, specific autoantigens like citrullinated proteins play a key role. The presence of anti-citrullinated protein antibodies is a hallmark of RA and is less common in other autoimmune conditions. The immune cells involved in RA also differ. Autoreactive T cells and B cells interact in a complex way. T helper cells activate B cells to produce autoantibodies, such as rheumatoid factor and anti-citrullinated protein antibodies. These autoantibodies form immune complexes that contribute to joint inflammation. While autoreactive T and B cells are found in many autoimmune diseases, the specific autoantibodies and their targets vary, which helps define the disease. Another distinguishing factor is the cytokine profile and inflammatory mediators. RA is marked by an overproduction of pro-inflammatory cytokines, including tumor necrosis factor alpha, interleukin-6, and interleukin-1. These cytokines drive inflammation and joint destruction. Although elevated cytokines are common in autoimmune diseases, the dominant cytokines and their roles can differ. For instance, tumor necrosis factor alpha is particularly important in RA, which is why treatments targeting this cytokine are effective. Genetic and environmental triggers also play a role in RA's unique response. There is a strong genetic component associated with certain HLA-DRB1 alleles, often referred to as the shared epitope. Environmental factors, such as smoking, can trigger or worsen the autoimmune response by promoting protein citrullination in the lungs. This gene-environment interaction is somewhat unique to RA compared to other autoimmune diseases. Chronicity and joint-specific damage further distinguish RA. Unlike some autoimmune diseases that may have systemic effects without localized tissue destruction, RA causes persistent inflammation leading to progressive joint erosion and deformity. This chronic inflammation specific to joints sets RA apart from autoimmune diseases that primarily affect other organs or systems. Despite these differences, RA does share some common features with other autoimmune diseases, such as immune dysregulation, genetic predisposition, and environmental triggers. However, the specific characteristics of RA's autoimmune response are crucial for developing targeted therapies and managing the condition effectively. Understanding these distinctions helps in tailoring treatment approaches for individuals with rheumatoid arthritis. Always consult healthcare professionals for personalized medical advice and management options.